psychiatry. So whenever I am asked to speak, I often, to a group like this, I often ask, which is the most important period in a person's life? So many people say that is the older age when we are mature. Some people say this is when adulthood is the middle adulthood, some early adulthood. But I think there is a consensus that the first 5 years is the most important period in a person's life. So that is one of the essential cornerstones which parents should follow. And most of the person's personalities, early development, the foundations are laid during the first 5 years. So what we are going to teach them, what the morality, the wisdom, the empathy, the kindness, the love for fellow human beings, all the virtues which we are going to instill in the first 5 years are going to last. Maybe the second phase ends till by about 12. And beyond 12 years, it's hardly very little the parents can. So, and then by 18, they are on their own. So we must be mindful of this. This is a very important first step. And one of the important steps which people miss often is what is known as a discipline. We always speak of discipline, but I would like to speak on the discipline of denial. Discipline of denial is to deny to our children what we can easily afford, but which their fellow students can't afford. For example, if my son wants a car, but his fellow students are unable to do that, by that, you don't give him a car. You can make special excuses that you're in financial trouble. It is going to be, we should have it from the very beginning. From flamboyant dressing or buying ornaments or buying the best dress, taking them to 5-star hotels. Nothing is bad, but everything that is not going to help them to interact or relate with their own colleagues is not really good. So that is very important. You know, one of my favorite psychiatric professors is Carl Menninger, who was professor of psychiatry in Harvard. And he was once he has wrote many famous books. Some of his famous books like Human Mind, The Crime of Punishment were bestsellers. In 1981, he was awarded by President Jimmy Carter awarded him the United States Presidential Medal of Freedom, which is the highest honor, which is the equivalent of our Bharat Ratna. So I just want to tell him how highly he was regarded during his lifetime. He once went to a college where he was a speaker, met a secondary school where he was a speaker. And then the students, after they were there, they asked him, there was an opportunity, and one of the students asked him a question. What will I do if I am mentally broken? The question simply it appears very easy to answer. You know, when you are mentally broken, a student should approach the student counselor or the teacher counselor or the college psychologist or the psychiatrist who has some liaison with them. That was the expected answer, but Carl Menninger surprised every one of them by saying that if you are mentally broken, you go and visit your poor neighbor. Spend time with them. Try to learn their problems. Listen patiently. You will understand how different world you are living. And you must try to help them in your own way. So that's a big lesson. That's a lesson which Carl Menninger used to advocate. So this is what is relevant for all of us. I have work with a lot of non-government organizations. So like in Kottayam, we have something called Navjeevan, Mariasan, where a lot of people with mental health problems are rehabilitated. Some of those centers have 300, 400 inmates from desperate circumstances who have been orphaned, who the families have left them. Many of them are recovered from their mental illness, but they are no longer welcome at their rooms. So in my college, where I take my students regularly for a one day visit to this place, not as tourists, but as helpers there. They go and some of my students bathe these inmates. Some of them cut their hair, give them clothes, wear them. So this is a big learning. Many of them after graduation have said, sir, this is the most biggest learning I have learned in my life. So, Freud is one of the persons who have put psychiatry and psychology in the high pedestal. And or Sigmund Freud, one of his quotations, which is one of my favorites, is that, quote, one day in retrospect, the years of struggle will strike you as the most beautiful. One day in retrospect, the years of struggle will strike you as the most beautiful. So often I tell my students, you have a lot of struggles. But looking back, or if you look back, all of us will know that the years of struggle which we had undergone have been really blessing. Whatever we had, it has led to tremendous personality growth. Our resilience has been built on the period of struggle. So this is an important lesson. I don't think I have much time to deal about clinical problems, but as there may be a lot of teachers here. When students come with problems, we must be aware of the common mental health problems with our students in school, as well as in secondary school, early school, as well as in the early college can face. Some of them are very well known, some of them are not equally well known. I'm sure you are aware of the specific learning disorders, the autistic spectrum disorders, and the conduct disorders. But some other things are unknown. For example, something is very spoken nowadays is drug abuse. We should always be watchful of that. And another common disorder is early bipolar disorder. I don't have the time to tell it. I describe in detail, but some of the bipolar disorders can make their earliest manifestations in early childhood and early adolescence. So whenever you suspect something, they have some biological origins. The bipolar disorders, and that cannot be solved by mere counseling or psychotherapeutic interventions. They may need some psychiatric treatment. And then we must always be aware of the suicides, the risk of suicides. In fact, you will know that suicides constitute the second highest cause for mortality among children and early adolescents. Of course, the first one being accidents, because many are recurrence. But suicides form the second highest cause for death among early adolescents. I will show up with a story, then a real incident. While I was in Tricur Medical College, I was a professor there between 2005 to 2008. A secondary school student was brought to me. Actually, the person was in the intensive care unit after having been hit by a private bus. It was speeding. It's a bus on the road, and the boy was critically injured, but he survived. And the police inspector, the DYSP came to me, sir, we want your help, because this driver is telling me, sir, I was very careful. But I can assure you, sir, this boy had jumped point blank in front of my bus. I couldn't do anything. So he was actually arrested. The driver was arrested for negligent driving and he was in jail. But the way in which he was speaking from his heart made the investigating officer very suspicious. So he wanted to know. He wanted to take my story. I said, this can be possible, but I'll check. So I had a number of sessions with this young boy. So he was from very affluent family. His brothers, sisters, one brother and their youngers, they're all toppers, and he was falling back and he was feeling very desperate. He never had anyone to really communicate his problems. So he decided to end his life. And that is what he has done, jumping in front of a bus. And although he was miraculously saved, of course, I could work with him, and he has now graduated from engineering college and is doing well. So these are, of course, that was a miraculous escape for him. And these are some of the things we should always keep in our mind. Whenever anybody expresses any suicidal ideation, or they may usually do it indirectly. Please be mindful of that. We have to be very careful. This can be a sign of depression. This can be a sign of acute stress disorders. It can be a sign of any other emotional distress. Be mindful of that. Thank you once again.